If you wake up every morning needing to clear your throat before you can speak, and this has been happening for months or years, nobody has told you why. You probably blamed allergies, or dry air, or just getting older, and every morning, the same thing happens. You wake up, you feel that thick, sticky coating at the back of your throat. You clear it. And then, you clear it again. Maybe you've stopped doing things because of it, stopped talking as much in the morning, stopped singing, stopped sitting near people in quiet rooms. For years, doctors, videos, and health articles have pointed to the same handful of answers: reflux, postnasal drip, dairy, dry air. Those things can contribute, but there is one cause that affects a very large number of people over 70, and almost no one is talking about it by name. Betty was 73 years old and had been singing in her church choir for 11 years. Then she stopped showing up. She could not get through a single hymn without stopping to clear her throat. The woman next to her had started shifting away in her seat. Betty didn't know what was wrong. She assumed it was age. It wasn't age. It was a medication she had been taking every single day. A medication her doctor had never connected to her throat. The people who never hear what I'm about to tell you keep assuming this is just something that happens after 70. The ones who do hear it ask one specific question at their next appointment, and the symptom goes away within weeks. Have you or someone you love been clearing your throat every day for months, and no one has explained why? Tell me in the comments below. I'm Dr. Sarah Kim, emergency medicine physician, 15 years in preventive care. Let me show you what I found. Let me show you exactly what is happening, starting with what your throat is doing right now, before the medication enters the picture. In my practice, I see patients over 70 who have been clearing their throat every day for a year or more. Most of them are on blood pressure medication, and most of them have never been told that the two things might be connected. Think of your throat like a self-cleaning drain. Tiny hair-like structures line the inside of your airways. They beat back and forth constantly. They move mucus up and out before you ever notice it. After 70, those tiny hairs slow down. A 2022 review from the University of Nebraska Medical Center found that aging causes a kind of chemical wear called oxidative stress that builds up in airway tissue over time and slows the beating of those hairs. Mucus lingers longer. You feel it. You have to clear it manually. That slowdown is real and it matters, but it is not the whole story. Now add a blood pressure medication to that picture. A specific class of blood pressure medication, called ACE inhibitors, has a known side effect. The drug interferes with a chemical signal in your body. When it does, another chemical, called bradykinin, builds up in your airway lining. Think of bradykinin as a fire alarm. When it accumulates, it triggers irritation and mucus production, whether you need it or not. That is not an allergy. It is not aging. It is a predictable chemical reaction to the medication. Here is why it hits harder after 70. Your throat's self-cleaning system is already slowed down. The bradykinin irritation is already producing extra mucus, and many people over 70 also take aspirin or an anti-inflammatory pain reliever. Those medications thin the protective layer inside your stomach. That allows acid to creep up into the back of your throat, a condition called silent reflux, because it often has no heartburn at all. Just throat mucus, just that constant need to clear. After 70, these three things can run at the same time. That is why your symptom may feel worse than anything a single explanation can account for. And the research confirms every one of them, starting with the medication connection most doctors never mention. A 2023 review in the Journal of Clinical Hypertension pulled together 135 studies and over 45,000 patients, and found that ACE inhibitors cause 3 times more cough and throat irritation than ARBs, a different class of blood pressure medication. Between 5 and 35 out of every 100 people on an ACE inhibitor develop this symptom. If you are on one of these drugs and your throat has been bothering you, there is a real chance the medication is the reason. That same review confirmed something important. The symptom is not about the dose. Cutting your dose in half will not fix it. The problem is the drug class itself. Switching to a different blood pressure medication class can stop this symptom entirely. A 2022 study from the University of Nebraska Medical Center confirmed that the slowing of your airway's cleaning system comes from a physical change that happens in older airways, not random wear, a specific process. This slowing is not random. It is a physical change that happens in older airways, and it makes everything worse when a throat irritant, like an ACE inhibitor, is also present. The slowdown has been confirmed in human tissue, not just in lab studies, but in airway samples from older adults. A 2022 study from Amsterdam UMC looked at 31 studies on nighttime acid creep, also called nocturnal reflux. It confirmed that elevating the head of the bed and sleeping on the left side significantly reduces overnight acid movement into the throat. If your throat is worst in the morning, your sleep position may be making it worse. A 2023 study confirmed that aspirin and anti-inflammatory pain relievers raise the chance of acid reaching the throat. If you take aspirin daily for your heart, your throat mucus may have more than one medication driving it. One more thing before the action steps, and this one is specifically for CPAP users. If you use a CPAP machine and your throat mucus started or got worse around the same time, check your humidifier settings and your device history. Dry or poorly humidified air from a CPAP device can compound the irritation. Mention this to your prescribing doctor. Here's what to do with this information. First, look at your blood pressure medication label. The ACE inhibitors, the ones that cause this, include these drug names: ramipril, lisinopril, perindopril, and enalapril. If one of those names is on your bottle and you have been clearing your throat for months, that is your starting point. Second, know this before you call your doctor. Reducing the dose will not stop the symptom. The bradykinin buildup happens at any dose. The fix is switching to a different type of blood pressure medication called ARBs. These include losartan, valsartan, candesartan, irbesartan, and telmisartan. ARBs lower blood pressure through a different pathway. They do not cause this side effect. Third, use these exact words at your appointment. I'd like to discuss whether an ARB would be appropriate for my situation. That is it. You do not need to self-diagnose. You do not need to demand anything. That one sentence opens the door. If your throat is also worst in the morning, add two things. Elevate the head of your bed, not just your pillow, the entire head of the bed by a few inches, and stop eating at least 2 to 3 hours before lying down. If you are on aspirin or an anti-inflammatory, mention that too. Your doctor needs the full picture. One more thing. Diuretics. The water pills many people take alongside blood pressure medication can cause dryness in the throat and mouth. That dryness can make mucus feel thicker. Mention any blood pressure-related medications you take, not just the one on the label you're looking at. For post-nasal drip, saline nasal rinses are not a folk remedy. The European guidelines on sinus and nasal conditions rate them among the highest evidence tools available for reducing post-nasal drip and throat irritation. This is a first-line clinical recommendation. Before I close, let me tell you what happened to Betty. 4 weeks after Betty's doctor switched her off the ACE inhibitor and onto a different blood pressure medication, she sang through the full Sunday service without stopping once. The tightness at the back of her throat, the thing she had told herself was just getting older, was gone. She stood in the choir section again. She sang all the way through. She did not have to stop. What could not be reversed was the 2 years she had spent sitting in the back pew. 2 years of assuming nothing could be done. 2 years that did not have to happen. ACE inhibitor-induced throat irritation is very often reversible. In the clinical trials reviewed in the Journal of Clinical Hypertension, symptoms resolved within 1 to 4 weeks of switching to an alternative medication. Not months, weeks. The limitation is what Betty already lost. The time spent thinking this was just aging. That part does not come back. But from the moment the right question gets asked, it can move fast. Before I close, I want to ask you something directly. Have you been clearing your throat every day for months or years? Did anyone ever connect it to a medication? Maybe you've already figured part of this out. Maybe you switched medications and it helped. Maybe you're still searching. Whatever your experience is, tell me in the comments. You are not the only person watching this. The person reading your comment next week might be in the same situation you were in last year. Your story matters here. This is general health information, not advice for your specific situation. For your own case, speak with the physician who knows your full history. You are someone who now knows exactly what to look for on your prescription label and exactly what to say at your next appointment. If you have a spouse, sibling, or close friend who is managing blood pressure after 70 and has been clearing their throat for months without knowing why, share this with them before their next appointment. One conversation with a doctor, with the right words ready, can change this. I get messages every week from people who wake up every morning needing to clear their throat and have been doing it for so long they stopped believing it could change. If that is you, or someone you care about, subscribing means you will not miss the next time I cover something this specific. New videos go up every week. Hit subscribe so you are here when they do. Coming up next week, why your blood pressure medication may be affecting your sleep in a way your doctor has never brought up. Right now, take one slow breath in through your nose and feel how clear your airway actually is. I'm Dr. Sarah Kim. I'll see you in the next one.